It's kind of effed up how little we actually see our patients in the hospital, right? I'm a medicine resident, and so you'd think I would be examining and seeing my patients throughout the day, but I'll literally see them for under 2 minutes a day. Especially now as a senior, I basically dispatch the interns to go see the patients, literally the least experienced doctors in the hospital, or I rely on the nurse to annoy me enough about the patient that I get up to go give them a second glance. My attending is even worse. He'll walk into the room, ask them how breakfast was, and then leave. Sometimes it's just a quick look from outside the door. Like you drop your loved one off at the hospital thinking a doctor is caring for them, but buddy, I barely even remember what they look like. Makes you think, huh? Wow. Very interesting post, and honestly, not very far from the truth at all. Especially for me, as somebody who's been in a senior resident role as well, I don't see the patients as much as I used to. I definitely don't because, we got 16 patients. It's hard for me to go see all of them while managing all the people on the team as well. Although recently I have been doing these bedside rounds, like true bedside rounds. And man, I could rave about them all day long because last block where I was on wards, I got to do it for the first time. And that really was such a great experience. And I really think everybody should do true bedside rounds. And I think there's so many advantages to it. But to be honest, this is very, very true. And I think a lot of patients will start to notice this about healthcare as well. The doctor really does not have that much time to spend with patients. They really spend very minimal amounts of time with the patient. And then after that, 90% of the day is spent in front of a computer. And, we're still thinking about the patients the whole day. We're doing all of the patient care that needs to be done and reviewing their chart very, very extensively. And so in a sense, I still feel like we know the patients very well, but just that face-to-face time with the patients is pretty limited. And it kind of feels bad to me because I think the best part of being a doctor is to counsel the patient on what's going on and what they need to do to make their health better. But it gets very lost nowadays because of just how much documentation we have to do that really we don't get to spend much time with patients at all. So I think this person's perspective is very, very much true that you can essentially practice 99% of medicine without even seeing the patient. And it's kind of a sad thing that's kind of lost nowadays in medicine. I've made a point of spending more time with my patients and spending less time in front of a computer. Sometimes I'll even chart on a patient in the room and just chat with them while I do it. This is something that's interesting. I feel like it would be a nice thing to do my work, write somebody's H&P while I'm in the room with them. But I can see that being very, very distracting. It's also not the best area because usually you're in the ED and it could be kind of gross and kind of messy and loud. But, I do like to use the workstation while I'm talking to the patient. I had one attending who said, you should really speak directly with the patient and not be on the computer when you're in there. But to be honest, I feel like it allows me to spend more time with the patient if I'm both reviewing and putting in orders and stuff. So the patient will feel like I'm in there longer because I actually am going to spend more time with them if I'm also on the computer getting work done. It's just a more efficient process. So I think for me, this is something I'm going to do more as well is, when admitting a new patient or, even some patients on the floor, maybe just doing some of their documentation on their notes while they're there, while I'm in the room with them. And that might be one way to get some more patient interaction time. I used to work in a hospital where the chief was very adamant that you would only talk about the patient with the patient, meaning all or at least most talk about future plan and treatment happened on rounds in the patient room. I kind of liked that approach. That's kind of like the bedside rounding that I was talking about. Obviously, residents and residents hate bedside rounds, but I think it's mainly because they aren't done correctly. You're not doing them in an efficient way. When I was doing them, we had a capped list all the time, and I made sure we always finished within 2 hours or 2.5 hours on pickup days where we were getting new patients overnight. So you can definitely make it work. You just have to run it in an efficient way. And obviously, I've only done it one time, so maybe that perspective will change. But I really feel confident in the benefits of bedside rounds, and I think it actually saves time if it's done efficiently and makes patients more satisfied and more educated as well. So you'll see that these people say, I hate that. It leads to rounds getting bogged down and orders getting delayed. I'll go talk to the patient on my own later. And, what actually ends up happening in this scenario? 99% of the time, that person does not go back and talk to the patient on their own later. I feel like most of the time they're not going to go back and talk to them. And you can see this one got 107 upvotes, whereas the initial post only got 84. So you can see how strongly people feel about not liking bedside rounds. But honestly, I so strongly feel that it's just because bedside rounds are not run correctly. And if they're run correctly, they will work and people will enjoy them. Yeah, enjoy 12-hour rounds doing that. I would hate my life. Long rounds literally slow patient care. And that's why when I'm doing rounds, I bring the workstation on wheels so that we are putting in orders and consults and everything while we're doing rounds. So no aspect of patient care is going to be held up while doing that. But worst thing to do not do hallway rounds and then go talk to the patient after that. That's the worst one, the worst option out of everything. If you're going to do one, you can do table rounds, or you can do true bedside rounds. Do not do hallway rounds and then talk to the patient. And do not do table rounds and then go talk to the patient with the whole team. That's just so time inefficient. We did this pre-COVID, and typically we're done with rounds in 2 to 2.5 hours. The onus was on the senior resident to keep things moving, so maybe we were efficient. And I agree. If you run it well as a senior resident, you can make them efficient, you can make them fun. People get more learning, and people, I'm starting to realize this video is more a video about bedside rounds than it is about like how much we're seeing patients. But I'm so passionate about bedside rounds, especially after this last month of wards. And like you're doubling the clinical volume of your interns. I remember when I was an intern, I got kind of bored after a while, like doing table rounds all the time. I wanted to see what the other patients looked like on the other half of the list and what their hospital course looked like. And seeing them on rounds was really kind of a fun experience. And I feel like kind of doubles your clinical volume and allows you to see more patients and their hospital courses and how they do. It's so good to have bedside rounds because everybody gets more learning too, and the patients like it too. Like in all regards, bedside rounds are so much better. So I'll talk about it more in another video, but I love bedside rounds for sure. It's sort of sad that doctors only spend 15% of their day actually seeing patients. Me to my intern when I was a student. Shit, 15%? That's rookie numbers. You got to get that shit down to 5%. My very burnt out intern. And I realize like how bad this makes the whole medical profession and physicians look in general, but it's not entirely inaccurate. Like we just have to spend our whole days behind a computer and documenting and putting in orders and responding to pages. And especially if our patients are not in the same geographic area, it becomes very hard to see them a lot throughout the day. And you just don't have time to spend 20 minutes with each patient. Imagine you have 16 patients, you spend 20 minutes with each of them. That's like 5.5 hours. Like you literally cannot afford to spend 20 minutes with a patient. That's why physicians only spend 5 minutes with patients. So yeah, it's tough. Yes, kind of effed up. On the other hand, I think patients have an unrealistic view of how much their history and physical actually contributes to their care. Like, yes, at one point 50 years ago, your doctor probably spent far more time listening to your involved, detailed story about your poop and tapping on your tummy. But standard of care now is based on having easily accessible imaging, frequent vitals, and laboratory correlation. And I'm pretty sure our outcomes are better now. So more time in the room is not equal to better care. And I don't want to waste valuable time just to boost a Press Ganey score. Value added time for the win. Totally, I think this is a great perspective. And the reason we don't spend as much time with patients is because a lot of the data that we need is not coming from the patients anymore. It's coming from their tests and the imaging that we get. And it is more useful for us to review that data that's coming in and then make plans based off of that rather than, talking with the patient for a long time. And, what does the patient want? Does the patient want the optimal plan, or do they want to have a conversation with their doctor? I mean, ideally they should have both, but if they want the absolute highest quality of care, it's probably more effective if the doctor is spending that time reviewing their chart and their labs and their imaging in a computer rather than, shooting the shiz with them and just like having a casual conversation. But obviously as a doctor, you need to be the one who's like updating the patient on what the plan is and what's going on and help them understand their disease process. So it is a delicate balance, but I think this is a really great perspective for why we are not spending as much time with patients anymore. Yeah, it sucks the biggest balls. I got into this for the people. F insurance companies, MBA hospital, F sticks, who couldn't even hold my jock strap when it comes to skill/intelligence. F politicians who succumb to lobbyist demands. It's only the patients who get screwed after all, and the doctors who actually care for them. Who cares? Yeah, I think it can be very easy to become very jaded about this stuff. But that's why we got to, continue doing the best we can to spend time with patients. But the fact of the matter is that the money is in the documentation and the billing. And so that's, where the pressures are demanding that we spend most of our time, unfortunately. Anyways, that's it for this video. Just a quick little discussion about why we are seeing patients for less time in the hospital. And if you ever wondered about why doctors don't seem to spend that much time with patients, this is one of those reasons. And this is something that we lament as well. We would love to spend more time with patients. So curious to hear what your thoughts are. Leave them down in the comments down below. And thanks again for watching. I'll see you in the next video, and peace.